Dr. Huebner here, Natural Transplants. I wanted to talk about an issue today concerning women and hair loss. So certainly 1 out of 4 of our clients is female, and the majority of those females are traction alopecia, but we also have a lot of genetic alopecia that responds very well to hair transplants. But in regards to the traction alopecia, there are some things with women that you want to make sure that you have covered before you have a transplant. There are other conditions that women have that are unique to women that will sometimes impede the transplant from working. There's a condition called CCCA. It's a long abbreviation, but basically the idea is that it takes, your body is basically attacking your own hair and you lose the hair, and sometimes the transplants work and sometimes they don't work. There's also something called frontal fibrosing alopecia. Again, it's sort of an autoimmune where your body attacks its own hair follicles. Sometimes, again, if those conditions are stable, the hair transplant will work, but sometimes they don't work. There's other conditions. There's one called alopecia areata, which almost never responds favorably with a hair transplant. So how do you kind of sort through all of this? Well, number one, women need blood tests, just some very basic blood tests, some hormonal tests, thyroid, and some basic blood that can just basically rule out those rare conditions that can sometimes cause hair loss. But in addition to that, we often will recommend that a woman have a scalp biopsy in which a dermatologist will take a small punch of skin in the area that's affected and put it under a microscope and send it to a lab where they'll look at it and they can diagnose which type of alopecia. Alopecia is just a fancy medical term for hair loss. Which type of alopecia you may have. It's very important prior to the transplant to know exactly what type of hair loss or alopecia you have to make sure that you're going to be a candidate for the hair transplant. If you have any questions about this, please call us. We're very willing, me and Dr. Siegel and Dr. Huebner, my brother, Tom Huebner, will be very happy to discuss all these possibilities with you, the process that you would have to go through. The biopsy is not required of everyone, but certain clients, after we see their pictures or talk to them on Skype, FaceTime, we'll have to have these conversations and really make sure that we're weeding out those people, and at least people understand what they're getting into when they have these types of diagnoses. So thanks again, and thank you for subscribing to our YouTube channel. Can't wait to see you guys, and call us for any questions you may have. Thanks again. Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.